My name is Nate Kuppermann. I serve as the chair of the Department of Emergency Medicine here at UC Davis. I think there were two things that were particularly of importance in that H1N1 study. First, with the topic aside, was the fact that we were able to collaborate not only with many institutions within the United States, but with many institutions around the world to address a very pressing and important clinical issue. The pediatric emergency medicine community recognized that we really needed to identify clinical factors and signs at the time a child presents to the emergency department that would identify children who would go on to have severe disease so that we could focus our attention, our resources on those children. So when we actually initiated this study, we were in the middle of this pandemic and we were bombarded with patients. And there was a lot of well patients that really did not need the use of the emergency department, but they were scared because this disease was out there and there were some very notable severe outcomes. So identifying factors associated with adverse outcomes, with bad outcomes, not only helps clinicians, but also helps families to know perhaps if they need the emergency department or not. So what this network did is it provided enough cases that the results have what we call tiny confidence intervals. That is, you could be very confident that the factors that we identified, in fact, are important factors to look at when you're evaluating a child with influenza-like illness in the middle of a pandemic like this. We identified almost 300 of these very severely affected children who died or had breathing tubes placed or were in the ICU on strong medication. And we had twice as many control children, that is, children with influenza-like illness who did not have those adverse outcomes. And by doing a complex statistical analysis in this big global network, we identified 6 factors that clinicians should focus on at the time a child presents to the emergency department with influenza-like illness. 6 factors that we identified were a history of cerebral palsy or developmental delay, a history of chronic lung disease such as bad asthma, physical findings of chest retractions, that is, the chest is moving very hard because the child's having difficulty breathing, signs of dehydration, the fact that the child required oxygen to maintain their blood oxygen level at a normal level, and finally, a fast heart rate for age. One of the really great byproducts of this collaboration is that we've now established this global network of networks. And in fact, we're in the middle of 2 other research studies in PERN. PERN is, again, this network of networks that address, one is bronchiolitis, which is the most important respiratory illness in childhood, and one is poisonings in children, in which we're doing these 2 separate studies looking at phenomena at a global level. And now we've established this consortium, we're meeting on a regular basis, and when worldwide medical crises in children appear, we now have a mechanism and an infrastructure to study them quickly.